133,000 people in Maryland's 3rd Congressional District, where I have the honor of representing, rely on Medicaid as their primary health insurance. But even if you're not a senior or a child or a neighbor with disability who relies on Medicaid, the proposed cuts here in Washington could very well reduce your access to care and the services that you receive. And that's today's topic of Medicaid Moment. Hospitals across this country, and particularly in rural communities that serve a large population of folks who utilize Medicaid for their health insurance, are already on very tight budgets. Any hit or cut to the Medicaid funding will result in significant pressure and the closing of hospitals across this nation. Number two, we already have some of the nation's leading wait times in the state of Maryland. Folks are going to get sick whether they have health insurance or not. And when they are sick, they're going to show up to emergency departments instead of their primary caregiver, which is going to result in longer wait times at our EDs, but also what we call uncompensated care for those hospitals because they have a duty and an obligation to treat those patients. And 62% of America's seniors who are long-term care residents in nursing facilities rely on Medicaid as their primary health coverage. There's simply no way for our very fragile healthcare system to take a nearly $1 trillion cut without seeing consequences to communities nationwide. That's why I voted no weeks ago when the bill was in the House. That's why I'm hoping the Senate, better angels and cooler heads prevail. And it's why I'm looking forward to continuing to champion healthcare coverage for Americans every single day.